right, everyone. Guess what? Rhonda's back with a video blog update. Two things for you today. So stay tuned to hear both things. First thing is about home assessments for those manual wheelchairs. The second thing, I'm going to give an update on the oxygen test results. And I'm doing that one second because it's a little bit longer of an update than the home assessments for the wheelchairs. So if you do both, you need to listen to all of this. If you just do one or the other, then you can still listen to all of it because, come on, why wouldn't you want to listen to what I say? Um, or you can just listen to what you need to listen to. So let's start with the manual wheelchairs. Throughout the course of the last 6 months, I'd say there was a lot of discussion about whether or not a home assessment needed to be done for a manual wheelchair in person. And there was a lot of interpretations of the policy, and depending on how you read it, what you were interpreting. That makes sense. Now that I'm listening to myself, it didn't make sense. Bottom line is there were some interpretation issues. Technically, you've never had to go in the home to do a home assessment because the policy never said that. The policy said at the time of delivery. Time of delivery means what? I mean, time of delivery didn't say delivery to home. So anyway, I'm not going to belabor over that because regardless, the medical directors cleared this language up because there was a lot of issues with some of the audits saying you had to be in person, and some of the information that was released by Medicare saying it had to be in person. And we were pushing back as a council with these contractors because of the issues we were seeing that there's no need for it. One is patients will let you know if they can't use their wheelchair in the home. They will call and tell you, right? So, um, and the policy didn't say in person. I know PMDs you do, so that's totally different. So do not even mix those two things up. These are manual wheelchairs. I'm talking in the manual wheelchair-based policy. So K1, K2, K3, K4. This is what I'm referring to. If you go to the policy article, they did put an update in the policy article, and this update, well, they say it was went into effect July 1, but it's always been there. Let's put it that way. Anyway, what it's saying is that they cleaned the language up. Is basically what it's saying, and it says, I'm going to find it here, so bear with me. For manual wheelchairs, the home assessment may be done directly by visiting the patient's home or indirectly based upon information provided by the beneficiary or their designee, regardless of the method used for the home assessment. That's where they changed it. Regardless of the method used, issues such as the physical layout of the home, services, all that kind of stuff when you do a home assessment. Obstacles to the use of the selected wheelchair may be addressed and documented in the home assessment. Information from the Benny's record and the supplier's record must be available upon request. So let's look at your home assessments. Your home assessments do not require a patient signature. Your home assessments do not require how these assessments are being done. All they're saying is we need to have an assessment done. We need to make sure the patient can use their wheelchair in the home to get at least one of their ADLs done. So that's all that's saying. So take a look at those home assessments and know that you don't have to make a trip to the home just for that. If you're delivering it to the hospital for a discharge, the questions can be filled out at that time with the patient, their family. If someone's coming into your store to pick it up so they can bring their loved one home or get the prescription filled, you can answer those questions then, or even call. I used to call as a supplier. If we weren't going directly to the home, we would call. We had our policy was to call within 24 hours of the delivery. So unless, if a delivery was on Thursday and it happened to be at 4 o'clock and the family's patient or someone came in to pick it up, then we either do it then or we'd call the next day. So that's what the home assessment piece is. You can go to the wheelchair policy article. So you have the LCD and then there's a policy article that's always attached to it. You can go to that and get that looked at into. The second piece, and this I feel like is not just as, or it's just as important, maybe more important, depending on who you're talking to. This is still a thorn in my side. I was trying to find the pleasant words to say. So for home oxygen, the policy we know says that the treating practitioner must evaluate that they've reviewed the test results. Basically, that's what they're saying. And it says the treating practitioner evaluate the results of the blood gas study performed at the time of need. That's in the policy article, and this does come from the NCD, the National Coverage Determination. We as a council have been pushing back because in the audits for oxygen, they're looking for either the medical record to mention something about the oxygen test results, or for the treating practitioner to mention or co-sign the test results. So we were pushing back as an industry to get this clarified, because the reason it's still a thorn in my side is I look at it, and I'm a clinician, I'm an RT, but I look at it from the total medical record, which is what we're preached to all the time, the totality of the medical record, which test results are part of the medical record. That's why a prescription's written, right? So that's logic, but logic isn't always used. And, or maybe I should rephrase that. I don't know how to rephrase it, but anyway, that we pushed back as a council saying this is an issue because of the high volume of audits. You know, we'd gotten wind that reviewers were looking for some buzzwords. We had a lot of things that were happening with it. So we were like, okay, medical directors, can you revisit this requirement? These are the issues we're having. And we gave them real life situations of what's going on in a hospital setting, seemed to be the most problematic. But this is what's going on and what can be done. So if you haven't seen the news that came out, I know with CGS, it came out on July 3rd. And you can see my screen here. Noridian probably came out already too. I didn't look on their website, but this is by all the DME MACs. So it's national. So that means it's all 4 jurisdictions. And this came out, and it's specific to the treating practitioner evaluation of the blood gas study for oxygen. And what I'll go into is the bullet points here, and I'm going to read them to you because that's what I'm going to do. In situations where the blood gas study was not conducted directly by the treating practitioner, documentation to support the treating practitioner evaluated blood gas study results may include, and this is not all inclusive, the incorporation of a copy of the blood gas study or results from the blood gas study into the treating practitioner's chart notes. So they have to mention it, incorporate it somehow into their chart notes. And sometimes you can do that, I feel like, in a hospital setting when there's an H&P or something, and then that treating practitioner signing off on that. Or treating practitioner's documentation in which he or she references the evaluation of the blood gas study performed on a specific date. So they can actually document it in the note. Now remember, once these test results, or once his blood gas study is done, remember blood gas study is actually an ABG or the pulse oximetry. So once this is done, it doesn't mean that a new visit's required. It just means it needs to be recognized in the note, or needs to be recognized by the treating practitioner and incorporated in their notes. So let's say the patient went in for a visit and they're in the hospital, and maybe the test results are done after the doctor's been there. Let's think of that scenario. So that was a second bullet point where they actually mentioned some information in their medical record or a separate note. The treating practitioner's signature on a copy of the blood gas study results. The treating practitioner's signature indicates that they've evaluated the results. And then the last one here, inclusion of either the following on the treating practitioner's standard written order for home oxygen therapy blood gas study results, or reference to the evaluation of the study performed on the specific date, while inclusion of either of the above on the treating practitioner's SWO may support that the treating practitioners evaluated the blood gas study results as previously noted. The results of the study may be documented in the medical record rendered by the practitioner, qualified provider, or supplier of lab services who performed the study. When the treating practitioner directly conducts the blood gas study, the treating practitioner's documentation of that blood gas study results satisfies both the requirements that the medical record documentation include the results of the study and the treating practitioner evaluate the test results. So there's 4 bullet points here. these are all options. There's four options of how that treating practitioner can actually recognize the blood gas study results. So it's incorporating them into their medical record. So somehow those test results get incorporated into that record. If you know what I'm thinking, like how they just have the flow of all these tests, and it's like an H&P, and it has all of that information in there. The treating practitioner documentation is actually in the notes. So they've talked about the test results. So they'd have to have a specific date and not just say I reviewed the test results, but mention information about evaluating those test results, or cosign, which I've always said all along, that's the easiest, is to cosign, because then there's no interpretation of the buzzwords in the medical record. Or on the standard written order, they can reference that they reviewed those test results. Now remember, if that's happening, if you're putting this on a standard written order and it's marked where the doctor says I reviewed those test results, I wouldn't have it just listed on that order. I would have them check it, recognize it somehow on that order. But you also have to have the actual test results in the medical record. So in an audit, you still need those test results to show that it was done and that it's a valid test result. So there's a few options for you. So hopefully that clears it up a little bit. Yeah, that'll help. Or actually, I was reading back over this inclusion of either of the following. So I'm going back to bullet point 4, because this is, we have a lot of questions around this. Those of us that we knew this was coming out, like we knew something was coming out, we didn't know what, but now that we were reading it, we've had a lot of questions. And it says inclusion of either of the following on the treating practitioner standard written order for home oxygen therapy. So it can be blood gas study results or reference to the evaluation of the blood gas study performed on a specific date. So that they can put that on the test result, or on the standard written order, the actual test results, or they reference it. So something in there that you can reference, fill out, and they're recognizing it. I'd be interested to see what some of you come up with in this part of it, of how you would incorporate it on a standard written order if you're going to do it that way. But remember, you still need to get all that information. So in an audit, which it's not if you're going to get audited, it's when, and you can include those test results so that they have to match. So make sure even when you're getting the test results, and if you put this information on the standard written order, that they match, because if there's any discrepancy, they're going to take the actual test results over what's written on the order, and they could just even call it a denial in that audit, because there was no evidence then. So just keep in mind that if you put it on the order where there's a box they can check to say these are the actual test results that they reviewed, or there's a reference of the date of the test results, whatever that or is, they're trying to get cleared up here. I'm starting to talk in circles because I'm talking too much now. Just make sure that it's recognized by that physician in there. Again, I feel like the easiest is the co-signature still, but this is something to consider. Maybe see how it works. Maybe come up with some ideas on your standard written order, and you can let me know. And I'd be interested to see what you come up with so I can look at them. Now, I don't want thousands of these orders coming through, but just let me know. You can send me a message to let me know that, hey, I've got to update my SWO, and I want you to look at it and see if it meets this requirement. I'd certainly be happy to look into that. So anyway, so that's the 2 updates that I wanted to share with all of you. I know this is a little bit of a lengthier video blog, but for this, as you can tell, for this reason, this is why, because there was 2 big updates I wanted to share and clarify for you. Last thing I'll sign off on is we're doing one more billing show in Minnesota. It's in September, so we'll include a link in the show notes, or in the notes on this video blog, but make sure you check that out. It's the last one we have scheduled for this year. I'd love to see you all getting to Minnesota in September. It would be beautiful. It's a half a day show, so you can easily get in and out if you need to quickly. And it's nice to get out and do these shows and network, so you can make sure you're staying on task and up to speed with what's going on in the industry. Anyway, so that's that. I'll make sure that's included. And yeah, There you go. Now you have all the latest and the greatest from Rhonda. Let me know if you need anything else. Talk to you later.